Hey everyone, I am the nurse doc tutor Asia. Thank you for tuning in to my channel. Today's lesson will be on delegation. So if you are a nursing student that is struggling with knowing what tasks to delegate, I promise you this presentation will make delegation so easy for you. So let's get started. All right, so first let's start off by defining delegation. So delegation is the transfer of responsibility for a task to another person. So you're like, okay, why would I need to delegate? You would need to delegate because you're not Superman or Superwoman. So we know that taking care of the patient, it is a team effort. So that's why you have your CNAs, you have your charge nurses, you have your LPNs, you have your phlebotomists. We have all these people that are a part of the care team. And we want to be able to transfer some tasks to the appropriate person just to free us up. Because you're thinking now, like, I don't need to delegate anything. I don't need any help. But you're going to realize that caring for a patient is a team effort, and you're going to need your team members. All right, so who can you delegate to? So you as a RN, you can delegate to other RNs. Let's say if you were the charge nurse, you can delegate to other RNs. Okay, let's say you are the only RN on the floor. You can delegate to your LPN, so your licensed practical nurses. You can delegate to them. And later on in this presentation, we're going to talk about some things that LPNs can and can't do. All right, you then can delegate to your nursing assistants, which is your CNAs or your assistant personnel, and we're going to delegate to them routine tasks such as vital signs and hygiene, and we'll talk also more about what we can delegate to our CNAs and other healthcare workers such as, you know, your lab techs, your ultrasound techs, and things like that. All right, so let's talk about the 5 delegation rights. So before we go off just saying you get a task, you get a task, you get a task, there are 5 rights that we need to check off when we are delegating a task to someone. So the first one is the right task. We want to make sure that we are delegating tasks that are within the scope of practice of the person that you are delegating to. So you're like, Dr. Bonnet, so you mean to tell me I have to know the scope of practice of the people that I'm delegating to? Yes. You have to know what an LPN can and can't do and what a CNA can and can't do. And each state is different about, you know, what a CNA or LPN can't do. So it is really important that you follow your facility policies and your state scope of practice. So the next one is the right circumstance. You guys, this is so important. When we are delegating, we want to make sure that we are delegating stable patients. So this means we're delegating patients that are, you know, they're doing just fine. They're stable. They're not critical patients. So let's say that we have a simple task of like feeding a patient, right? We got a simple task that we can easily let a CNA do. It's feed the patient, right? But let's say that this patient just had a stroke and every few bites they are aspirating. Guess what? That patient is not stable. So even though it's a task that the CNA can do, which is feed a patient, but in this circumstance, this patient is not stable. This patient is aspirating all the time. So this would not be a patient to assign to the CNA. So the biggest thing is making sure, when it talks about right circumstances, making sure that this patient is stable. So if this patient needs like a continual assessment, if this patient needs close monitoring, guess what? We're not going to delegate that patient to a CNA. And also, we wouldn't even delegate them to an LPN. So we want to make sure that we are stable. We are delegating to stable patients, okay? So the next one is the right person. We want to make sure that we are delegating tasks to the appropriate person. And that kind of goes with the right task. So let's say that you, the right person. So let's say that you need medications passed. You're not going to ask the CNA to do that because that is not in the CNA scope of practice. But you could ask the LPN to do that. Or let's say you have the dietary person in the room. You're not going to delegate them to take the patient to the restroom, right? So you want to make sure that you're delegating to the right person. So the next next one is the right direction and the right communication. So you just don't want to delegate something just like go do that. No, you want to communicate. So like for example, let's say that you're delegating a blood sugar check. What you want to do is you want to tell that CNA, hey, can you go get the blood sugar in room 203, and then I want you to report back to me, and you want to give, you just want to give right direction and right communication. Let's say if the blood sugar reading was less than 70. So you then want to tell them, hey, if the blood sugar range is this, I want you then to report back to me. You want to give them clear direction, and you want to give clear communication, because you don't want there to be any type of miscommunication. So anytime that you're delegating, you want to make sure that you're giving clear directions, okay? And at this time, it is also important to ask the person that you're delegating to, hey, do you feel comfortable with this? Like, I know that this is a skill that you should know already, but I don't want to assume, is this a skill that you're comfortable with? So right here is a good time to be communicating with that person to see, how they feel about doing that task, okay? You never want to assume, that someone knows how to do something. You don't never want to assume. You want to give right direction and clear communication. All right. So the next one is right supervision and evaluation. So you're not just going to tell them to go do something and then, you just forget totally about it and say, hey, it's on them. Because the biggest thing to remember, even when you are delegating tasks, you are still responsible for that patient. So we as the RN, guess what? We take all responsibility. So it is important that you are supervising, so that you go back in the chart and you look at that blood sugar reading. You go back in the chart and you look at that blood pressure reading. Like, you just can't tell them to do something and you just totally forget about it. You have to supervise them and evaluate. And this also will be a time for you to monitor the progress of the delegated task. You guys, it is so important. Always, like, back to the step that we just talked about clear communication. Letting them know, like, hey, I told you to have the blood pressure at 9 o'clock. It's now 9:15. Is there something that is preventing you from getting this task done? You want to make sure that we are monitoring the progress of that delegated task. And also, this is a time to provide feedback to ensure that the task is completed safely. All right, so what are some things that you can and cannot delegate to LPNs? So I came up with this mnemonic. LPNs cannot enter the cabin. So C, central lines. LPNs should not be doing anything with the central line. Now, you guys, for some of you guys who are LPNs or you work in the facility, you will see that these things vary, right? But when we stick to NCLEX world say no. LPNs should not be messing with central lines. So if you are a person who is an LPN or you work in a facility, you want to put all that stuff on the back burner and you just want to stick to what your book says. NCLEX says that LPNs cannot do anything with central lines. Also, assessment. Your LPNs should not be doing the initial assessment. The initial assessment should be done by the RN. All right, so then blood products. LPN should not be administering any blood products. Also, the IV medications, LPN should not be doing anything with IV medications. And then the N, nursing care plans. So LPNs should not be initiating care plans or changing care plans or evaluating care plans to like switch them out. Now, what they can do is they can, once a care plan has been established by the RN, they then can, work within that care plan, but they can't initiate care plans. And if it would need to be changed or anything like that, then the RN would have to do it. So it is important to know what LPNs can't do. Now, LPNs can give medications. LPNs can give medications. LPNs can do CNA work as well. But our biggest thing is to know that the LPNs, they function under the supervision of a RN. So if you have an unstable patient, I repeat again, if you have an unstable patient, that is not the patient to assign to a LPN. So let's talk about some things that LPNs can do. LPNs can do nursing skills such as NG tube insertion, Foley insertion, and draw blood. They can administer oral, topical, sub-Q, and intramuscular medications. They can perform basic wound care and dressing changes, assist with patient mobility and transfer. They can collect specimens for lab tests. They can assist with basic respiratory care, such as putting the patient on oxygen. They can provide education on basic health care and medications. They can document patient care and observations, and they can collaborate with RNs and physicians with the patient's care. So it is so important to know the tasks that your LPNs can do, so you can make sure that you're delegating the right tasks. All right, so let's talk about CNAs. So I came up with this mnemonic: CNAs cannot eat. So CNAs cannot evaluate, assess, nor teach. So your CNA, their job is just going to be to do routine things like ambulation, transfers, feeding the patient, hygiene. But we want to make sure that they're doing that on stable patients, okay? But a CNA cannot evaluate. A CNA cannot evaluate. Let's say, this is a good example. Let's say that you gave a patient a blood pressure medicine because the blood pressure was super high. The CNA cannot evaluate to say like, okay, I rechecked their blood pressure and their blood pressure came down. A CNA cannot evaluate, okay? Even though they can collect the data for the nurse to evaluate, but the CNA cannot evaluate. The CNA cannot assess. A CNA cannot assess. So another good example, like if you're washing, the CNA is washing the patient and they find a pressure also on the patient, the CNA then can't go in there and document actually what they saw and all that kind of stuff. That's called assessing, right? So what the CNA would have to do, they would have to go call the RN, and then the RN would then be able to assess the wound. A CNA cannot teach. You guys, this is a big one, because if you are a CNA, you work in the facilities, you see that CNAs actually do a lot of teaching, but they cannot in the NCLEX world. So let's say that your CNA may tell the patient, hey, you need to get off your bottom. You need to rotate from side to side to prevent you from getting a pressure ulcer. You guys, that is teaching. Your CNA cannot teach. So I'm telling you, it is so important that you detach yourself from the real world and NCLEX world. So in the NCLEX world, the CNAs cannot evaluate, assess, nor teach. And also one thing that can help you when it comes to delegating to a CNA, we don't want to think that we're delegating to a CNA who has been a CNA for 15 to 20 years. That is super experienced, and that could really run circles around RNs, right? We don't want to think about them like that. We want to think about those CNAs that took a 4 to 6 week class. That's how we want to look at it, okay? So let's do some practice. So the question says, a nurse and an experienced licensed practical nurse are caring for a group of clients. Which of the following tasks should the nurse delegate to the LPN? Select all that apply. Is it A, administer a tap water enema to a client who is preoperative? B, obtain vital signs from a client who is 6 hours post-op? C, provide discharge instructions to a confused client spouse? Or D, initiate a plan of care for a client who is post-operative from a appendectomy? Or E, catheterize a client who has not voided in 8 hours. So I'm going to give you some time to think about it. So which of these patients would you delegate to a LPN? All right. So if you said A, B, and E, you are correct. So A, B, and E would be patients that we would delegate to the LPN. A nurse on the med-surg unit is assigning tasks to an assistive personnel, a CNA. Which of the following tasks should the nurse delegate to the AP? Select all that apply. Demonstrate the technique to instill eye drops. B, record urinary output. C, irrigate a wound. D, transfer a client to a stretcher. Or E, ambulate a client who has a cane. I'm going to give you some time to think about it. So if you chose B, D, and E, you are correct. B, D, and E. A nurse is caring for 4 post-operative clients. The nurse can delegate obtaining vital signs to an assistant personnel for which of the following clients? Is it A client who is 1 hour post-op following a thyroidectomy? 2, a client who is 2 hours post-op following an abdominal hysterectomy? Or 3, a client who is 3-day post-op following a gastric bypass surgery? Or is it 4, a client who is 3 days post-operative following a craniotomy? I'm going to give you some time to think about it. Which vital signs would you delegate to the CNA? So if you chose 3, you are correct. So we will be able to delegate them to a patient who had a gastric bypass surgery 3 days ago. So remember, we want to delegate them to the most stable patient. Now, the patient who had the craniotomy 3 days ago, think about it, you guys. What is a craniotomy? That's brain surgery. That's big. So we don't want to assign them to that patient, even though they've been post-op for a couple days. A nurse in a long-term care facility is planning care for several clients. Which of the following activities should the nurse delegate to the LPN? Is it 1, a mission assessment of a new client? 2, scheduling a diagnostic study for a client? 3, evaluating changes to a client's pressure ulcer? Or 4, teaching a client insulin injection technique? So I'm going to give you some time to think about it. So if you chose 2, scheduling a diagnostic study for a client, you are correct. Now this one would be kind of tricky to me because LPNs, they can teach, but to think about it, which one of these will be the safest option for the LPN to do? And that would just be scheduling the diagnostic study for the client. A nurse is planning care for a group of clients. The nurse should delegate obtaining vital signs to assistant personnel for which of the following clients? Select all that apply. Is it A, a young adult client who is 24 hours post-op from having their appendix removed? B, a young adult client receiving continuous IV infusion of regular insulin for DKA? Is it C, a middle-aged client who is status asthmaticus? Is it D, a older adult client who is 36 hours post-op from having their gallbladder removed? Or is it E, a older adult client who has a history of heart failure and is ready for discharge? So I'm going to give you some time to think about it. So if you chose A, D, and E, you are correct. So these are the most stable patients, A, D, and E. A nurse is organizing care for a group of clients. Which of the following tasks should the nurse delegate to the assistant personnel? Is it 1, assisting a client who is 12 hours post-op following their appendix being removed to use a bedpan? 2, demonstrating the use of a walker for a client who is ready for discharge? 3, offering a pamphlet regarding advanced directives to a newly admitted patient? Or 4, asking a client whether pain was relieved after administration of acetaminophen? So I'm going to give you some time to think about it. So if you chose 1, you are correct. They can place the patient on a bedpan. A charge nurse delegates to a licensed practical nurse the task of changing a client's dressing. Several hours later, the client reports that the dressing has not been changed. Which of the following actions should the charge nurse take? Is it 1, change the client's dressing? 2, reassign the task to another nurse? 3, verify the LPN knows how to do a dressing change? Or 4, report the issue to the unit manager? So I'm going to give you some time to think about it. So if you chose 3, You are correct. So verify that the LPN knows how to do a dressing change.